Hi, this is Joe Feeks, editor of Pig Health Today, and with me is Dr. Joe Connor. He is a veterinarian and president of Carthage Veterinary Service in Carthage, Illinois. Thanks for coming by, Joe.
Thanks, Joe. My pleasure.
I want to talk with you this morning about mycoplasma, and I realize there's a lot of talk in the industry about elimination, but initially I'd like to focus on control. And I was thinking the other day that, when you think about the big swine diseases, or at least the ones that get all the headlines, PRRS, flu, circovirus, they're all viruses. Mycoplasma is unique, of course, in that it's bacterial, which really gives you a much bigger toolbox for managing the disease, doesn't it?
Yeah, it sure does, Joe. And one of the interesting things is that mycoplasma's been part of the industry for years, but only more recently have we identified the ongoing costs of that particular bacterial infection. And so that's really what has driven our focus on control measures.
So when you think about disease, you can look at prevention, control, and treatment. With respect to grower pigs, if we want to talk about prevention, what's the best way to try to keep mycoplasma out of grower pigs?
I think there's several avenues that are quite important. One is we want to stabilize the growing gilt before she enters the sow herd, because there's been a number of studies that have indicated that an infected animal can shed this particular bacteria for up to about 250 days. So if we expose the young gilt to the natural infection, she will then not be shedding when she farrows her first time, and then that becomes a critical part of the control. The second part of the control process is still to vaccinate pigs or piglets, depending on the activity within the growing population. It's very common for us to vaccinate piglets quite young at our first processing, so at 3 to 5 days of age. Then the third part of the control, in addition to vaccination, is an inclusion of an antibiotic strategically placed during the active phase and the growing phase of that pig. One of the good changes that have recently come into is that we utilize lincomycin as an antibiotic to control the mycoplasma infection. It is now more flexible dosing, which allows us to include that from 100 grams to 200 grams for a 21-day period. Because of the nature of how mycoplasma transmits between pigs, which is quite slow, that window of 21 days becomes quite important to help control the infection pressure itself.
Now, you mentioned feed medication for mycoplasma. Of course, the industry has been backing off of those a little bit. We do have a good medication available for mycoplasma. It does require a veterinary feed directive. When and where is the medication a good option?
In our decision tree, we would look at the clinical incidence of the pneumonia. We would look at the closeout performance and make a determination the best we could as to how much of that performance restriction is due to mycoplasma activity. We have a number of diagnostic tools, Joe, to help us answer when should we strategically place a intervention such as lincomycin. So we can either do that through necropsies, through laryngeal tracheal swabs by PCR or by serology, as well as observing the pigs to say that this would be the age or the time at which we would put an antibiotic intervention in.
So what would be, is there a threshold where you would say, well, these pigs definitely have to be treated, even if it's from a welfare standpoint?
The thresholds we use are the prevalence of mycoplasma activity at weaning. What we know from studies is that if there's a high prevalence, and generally greater than 25% PCR positive at weaning, we're going to have early infections, or early infection and transmission, generally in a late nursery. If the prevalence is quite low, that activity is going to be very late in a finishing period. So based on that prevalence and then combined with clinical signs and mortality or morbidity, we would then say this is the threshold that we would use to intervene.
Now, you mentioned also a new claim that gives you more flexibility in terms of using medication. Could you speak to that a little bit?
Yes, up until recently, in the changeover on the VFDs, lincomycin needed to be included as a feed antibiotic at 200 grams for 21 days. Prior to that, most of the industry was using lincomycin for mycoplasma control at 100 grams for 21 days. The new labeling now allows that to occur and also allows a flexible dose between the 100 and 200 grams for the 21 days that can be determined.
Where do injectable antibiotics fit into the picture as far as mycoplasma goes?
Well, they remain quite important, and depending on the prevalence of mycoplasma at weaning, they are a key component of our control program. Antibiotics have been shown to reduce the transmission and the infection rate of pigs. Then, importantly as well, for the individual pig treatment, so the growing or finishing pig that would be clinically showing signs of mycoplasma, we would use an antibiotic there as well. And then lastly, antibiotics have played a role in the percentage of herds that are doing mycoplasma elimination.
So how do you know when to use an injectable, though? I mean, because you don't want to just use them arbitrarily. They're expensive, and you want to make the most of that investment. What do you tell your producers in terms of trying to walk the pens and spot the sick pigs?
Yeah, so what we use for them is a clinical activity, and mycoplasma generally results in a dry, long duration cough. The second thing would be to look at the individual pigs that are showing respiratory activity, which may or may not be related to the cough. And then the third would be an increase in mortality. And most of us use a threshold on mortality of a certain number of pigs that would die over a short time period as a trigger to go in and be more aggressive with individual treatments. Well, we do know from a number of studies that if our caregiver is good and can be trained to detect the pig that requires treatment, individual pig treatment remains the most cost-effective strategy we have, even for a bacterial agent such as mycoplasma.
Now, there's a lot of talk in the industry about eliminating mycoplasma. I know some vets have been successful doing that in a few herds, but it's not for every operation, is it?
No, it's not. What's progressed over the last 3 to 5 years has been a program that can be predictably highly successful, somewhere in the 80 to 90% range with elimination. But there's also other factors we need to consider. What's the likelihood that that population will become infected either by aerosol transmission or other methods of mycoplasma movement? And the second would be, what really is the cost of mycoplasma in the growing finishing population if it is the only bacteria that are infecting those pigs? So we try to make the decision based on what's the expected economic return if we do eliminate mycoplasma out of the flow. Part of the movement toward elimination has been that because we commonly do have co-infections in the growing pigs, including PRS or influenza, elimination of a bacterial organism such as Mycoplasma hyopnueumoniae can reduce the losses or the restrictions that the other two viruses would have on those growing pigs.
Now, you've done some research with mycoplasma elimination?
Yes, we've done considerable research. One, looking at the development of the program, so what's the most cost-effective program that we can utilize today to eliminate. And then secondly, a key component, as we discussed early in the conversation, was how do we expose growing gilts so that they are not shedding mycoplasma when they farrow. And today, most recent research has gone toward trying to expose them as a group so you can set a point in time, which is a very key component for the success of the elimination program.
What are you hearing at the 2018 American Association of Swine Veterinarians, because you've had the opportunity to compare notes with a lot of other veterinarians about mycoplasma trends and success rates?
A lot of discussion, and it's quite interesting that we have greater respect for the performance reduction with mycoplasma than we've ever had before. Secondly, we now have, as an industry, a number of herds that have eliminated mycoplasma, so we've got pretty good predictability about the key steps to be successful, and then the frequency of success. And then the third thing, discussion has been that if we have good stability within a herd, our traditional control measures still are quite important and can give us the most cost-effective grow finish performance.
Excellent. So what do you see, how do you see these programs evolving? Do you see more producers trying to get on an elimination program eventually, or is it going to hold it around the 10% that you mentioned?
I think, Joe, it'll move up slowly over time. The one aspect that came in this past year would be that we did get historically mycoplasma negative herds become infected, and so we're always going to go back and look at, can we determine the route of introduction? If we cannot determine that route of introduction, then it slows somewhat the elimination, because of the concern that we may not be able to prevent the introduction back into the herd. At the same time, as we increase the pig density in areas, we're always looking to eliminate bacterial or viral infections that we can eliminate in order to take them out of the spectrum of the combined infections. The last thing that was published here about a year ago would be that in the pig dense areas, so in the finishing density areas, that aerosol transmission is not as frequent as what we thought in the past. So if we can put well-controlled mycoplasma pigs in an area, they're not likely to become aerosol infected, is what we thought several years ago.
Well, Joe, great insights as always. I have a feeling we're going to be talking about this topic again.
Likewise.
We've been talking to Dr. Joe Connor. He is a veterinarian and president at Carthage Veterinary Service. Joe, thanks again for coming by.
Thanks, Joe.